Look down at your ankles right now. Are they the same width they were this morning? Or have they thickened since you sat down? Take off your sock. Look at the mark it left behind. Does that groove take more than a few seconds to disappear? If it does, I need you to hear what I'm about to say. Because most people with swollen ankles after 60 are told the same three things. It is your heart, cut your salt, it is just aging. And for the majority of people over 60, none of those explanations are the real cause. The real cause is a system inside your body that most doctors never discuss. It has no pump of its own, it cannot drain on its own when you stop moving, and after 60 it becomes significantly less efficient, silently, gradually, every year. It is called your lymphatic system. And in the next 20 minutes, I'm going to explain exactly what is happening inside your ankles, why it happens after 60 specifically, and a 5-minute nightly habit that drains the fluid before it disrupts your sleep. Pause. No medication, no compression stockings, no expensive treatment, just 5 minutes, done correctly, every night before bed. Stay with me. This is information your body has needed for years. My name is Dr. Elizabeth Kavaler. I am a board-certified urologist and urogynecologist. I have been in clinical practice for over 20 years. My patients are predominantly men and women in their 50s, 60s, and 70s. And ankle swelling, what we call peripheral edema, comes up constantly. What troubles me is how often it is dismissed. Patients are told to eat less salt, to rest more, to accept it. And the lymphatic system, the actual source of the problem in most cases, is never mentioned. Today, I want to correct that. I want to give you the complete clinical picture, what is happening, why it happens after 60, and exactly what to do about it. Evidence-based, practical, and something you can begin tonight. Your body has 2 fluid drainage systems. Most people only know about one of them. Pause. The first is your blood circulatory system. It has a powerful pump, your heart, contracting 60 to 80 times per minute, driving blood through 60,000 miles of vessels, delivering oxygen and nutrients to every cell. Beat. The second system is your lymphatic network. This is a parallel network of vessels running alongside your blood vessels. Its job is to collect the excess fluid that leaks out of blood capillaries into your tissues, filter it through lymph nodes, and return it to the bloodstream. Pause. Here is the critical difference. The lymphatic system has no dedicated pump, no heart equivalent. It moves only through 3 mechanisms. Muscular contraction. When your muscles squeeze, they push lymph through the vessels. Diaphragmatic breathing. Deep breaths create pressure changes that pull lymph upward toward the chest. Postural movement. Changes in body position assist gravity-driven flow. Beat, which means when you stop moving, lymph stops moving. It pools in the lowest points of your body. In most people, that means the ankles. Pause. Now add the changes that happen after 60. Lymphatic vessels become stiffer and less elastic with age. The one-way valves inside the vessels, which prevent backflow, weaken. Overall lymphatic transport capacity declines by an estimated 40 to 50% between age 30 and age 70. Beat. The result is predictable. Fluid collects in your ankles during the day. Overnight, when you lie flat, it redistributes, flooding back into circulation, increasing blood volume, elevating blood pressure, and in many people, disrupting sleep. Pause. That is the complete picture of what is happening inside your ankles. Not your heart, not your salt, your lymphatic system. Not all ankle swelling is the same. There are 3 patterns, and identifying yours matters for the protocol. Pattern 1, evening accumulation. Ankles look normal in the morning. They thicken progressively through the day. By evening, they feel heavy, tight, and slightly warm. After a night of sleep, they look normal again. This is the most common pattern. It indicates primary lymphatic sluggishness. The lymph is slow, not blocked. This responds best to the protocol I will give you. Pattern 2, persistent swelling. Ankles are swollen in the morning and remain swollen all day. Sleep provides only partial relief. This pattern suggests both lymphatic inefficiency and venous insufficiency, where the veins are also struggling to return blood from the lower legs. This responds to the protocol, but also benefits from compression and elevation. Pattern 3, asymmetric swelling. One ankle significantly more swollen than the other. This pattern is different. Asymmetric swelling can indicate a localized lymphatic blockage, a deep vein thrombosis, or a joint condition. If your swelling is clearly worse on one side, please see your doctor before attempting any home protocol. Asymmetric swelling deserves clinical evaluation. Beat patterns 1 and 2, symmetric, bilateral, worse by evening, are what we are addressing today, and they are by far the most common presentation in people over 60. I want to give you 2 clinical self-tests you can do right now. They take less than 60 seconds total, and they will help you understand exactly what type of swelling you are dealing with. Test 1, the pitting test. Press your thumb firmly into the swollen area above your ankle bone. Hold the pressure for 10 full seconds, then release and look at what happens. If the skin springs back immediately, the swelling is likely lymphatic in nature. Lymph is protein-rich and creates a more fibrous, resilient type of swelling. If the skin stays indented, leaving a visible pit or groove, for more than 5 seconds, this is called pitting edema. Pitting edema indicates venous insufficiency, or less commonly, cardiac or renal issues. Pitting edema that is new, sudden, or accompanied by shortness of breath warrants a medical visit. Test 2, the stemmer sign. Try to pinch and lift a small fold of skin at the base of your second toe, right where the toe meets the foot. Pause. In a person without lymphatic involvement, you can easily lift a small fold of skin there. A positive stemmer sign, where the skin feels thickened, tough, or impossible to pinch into a fold, is a clinically validated indicator of lymphedema. It was confirmed as a reliable diagnostic marker in a study published in the Journal of the American College of Surgeons. Beat. If both tests suggest lymphatic involvement, which they will for most people watching this, the 5-minute protocol I'm about to give you is designed precisely for you. Before the protocol, I need to address 3 food traps that silently worsen lymphatic swelling. 2 of them surprise almost everyone. Food trap 1. Excess sodium. This one you probably knew. High sodium increases fluid retention by drawing water into the bloodstream and tissues. The daily target for adults over 60 is under 1,500 milligrams. One restaurant meal can contain 3,000 milligrams alone. Food trap 2. Refined carbohydrates and sugar. This one surprises people. High glycemic foods cause rapid insulin spikes. Insulin signals the kidneys to retain sodium, which then retains water. Refined bread, white rice, pasta, and sweetened drinks all trigger this cascade. Men and women who reduce refined carbohydrates often see ankle swelling improve within days, without changing sodium intake at all. Food trap 3. Alcohol. Alcohol is a vasodilator. It widens blood vessels. This increases capillary leakage into surrounding tissue. So as more fluid leaks out, more fluid pools in the ankles, even 2 drinks in an evening can produce measurably worse ankle swelling by morning. Beat. 3 changes: reduce sodium, reduce refined carbohydrates, moderate alcohol. Each one independently reduces the fluid load your lymphatic system has to manage. Combined with the protocol, the results compound significantly. Now, the 5-minute protocol. Do this every night before bed. The sequence matters. Do not skip steps. Step 1. Elevate your legs. 2 minutes. Lie on your back on a firm surface. A yoga mat on the floor works well. Place your legs against a wall or elevate your feet on pillows stacked 12 to 18 inches high. Your feet should be above the level of your heart. This is the most important step. Gravity does the initial work of draining pooled fluid back toward the core. A 1994 study published in the Journal of Vascular Surgery confirmed that leg elevation at this angle measurably reduces microcirculatory pressure in swollen lower limbs within 2 minutes. Hold this position for the full 2 minutes. Breathe slowly. Step 2. Diaphragmatic breathing. 1 minute. While your legs remain elevated, place one hand on your chest and one hand on your belly. Breathe in slowly through your nose for 4 counts. Your belly should rise, not your chest. Hold for 2 counts. Exhale slowly through your mouth for 6 counts. Repeat this for 1 full minute, approximately 6 to 7 breath cycles. Pause. Why does breathing matter here? Your thoracic duct, the main lymphatic vessel draining your lower body, empties near the collarbone. Deep diaphragmatic breathing creates negative pressure in the chest cavity, acting like a bellows that pulls lymph upward through the thoracic duct. A study published in PubMed Central confirmed that controlled diaphragmatic breathing measurably accelerates thoracic duct lymph flow in healthy adults. Beat. Step 3. Ankle pumping. 1 minute. Keep your legs elevated. Begin actively pumping your ankles. Flex your feet, pull your toes toward you, then point, push them away. Slow and deliberate. 1 pump every 2 seconds. This activates the calf muscle pump, the most powerful driver of lymphatic and venous return in the lower leg. The soleus and gastrocnemius muscles compress the lymphatic vessels with each contraction, pushing pooled fluid upward against gravity. Pause. Continue for 1 full minute. You will likely feel a slight aching reduction in your ankles as fluid moves. Step 4, lymphatic self-massage. 1 minute. Lower your legs and sit comfortably. Using both hands, begin gentle upward strokes on your lower legs. Start just above the ankle. Light pressure, no deeper than the skin. Stroke upward toward the knee, never downward. Pause. The lymphatic vessels are superficial. They sit just beneath the skin. Heavy pressure actually collapses them. You need only the pressure of a soft handshake. Stroke upward 10 times on each leg. Then move to just below the knee. Stroke toward the back of the knee 10 times on each leg. The back of the knee is a major lymph node cluster. Draining toward it accelerates clearance significantly. And step 5, final position, rest elevated. Final. Do this while falling asleep. Place 1 or 2 pillows under your calves, not your heels, to keep your lower legs slightly elevated as you sleep. This prevents reaccumulation during the night. It is the difference between waking with normal ankles versus waking with mild swelling that builds again all day. Pause. 5 steps, 2 minutes elevation, 1 minute breathing, 1 minute ankle pumps, 1 minute massage, sleep elevated, total active time, 5 minutes. Consistent results begin within 3 to 5 days.
I want to explain something that most videos on this topic completely miss. Why nighttime specifically? Why not do this in the morning or afternoon? Because of what happens to fluid distribution when you lie down. During the day, gravity pools fluid in your lower legs. When you lie flat at night, that fluid redistributes throughout your body. It re-enters the bloodstream through the capillaries. Blood volume increases transiently, sometimes by up to 500 milliliters. For people with already stiff lymphatic vessels, this redistribution is inefficient and disruptive. The fluid floods back faster than the kidneys and lymphatics can process it. The result is fragmented sleep, frequent nighttime urination, and morning puffiness that is worse than the evening before. By draining the ankle reservoir before bed, using the elevation, breathing, and massage protocol, you reduce the volume of fluid available to redistribute.
Less fluid redistribution means a smoother transition to lying down, better sleep, fewer nighttime bathroom trips, ankles that start the next morning closer to their normal state. Pause. This is why the timing is not optional. The 5 minutes before bed has a compounding effect that doing the same routine at noon never achieves.
Before I close, I need to address something directly. Ankle swelling in the majority of people over 60 is lymphatic and venous in origin, but it can also be a symptom of something that requires immediate medical attention. Please see your doctor without delay if your ankle swelling is accompanied by any of these: shortness of breath, especially when lying flat or with minimal exertion, chest pain or pressure, sudden onset swelling that was not there yesterday, swelling that is significantly worse on one side only, red, warm, or painful skin over the swollen area, fever alongside the swelling. These signals can indicate heart failure, deep vein thrombosis, infection, or kidney disease. None of these should be managed at home. The protocol I described today is appropriate for the most common presentation: bilateral, gradually worsening, evening dominant swelling in otherwise healthy adults over 60.
If you have any doubt about your specific situation, please speak with your physician first. I would rather you ask the question than assume the answer.
Let me tell you honestly what to expect over the next 30 days. Days 1 to 3. The protocol will feel unfamiliar. Some people notice slight relief immediately after the elevation and ankle pumping. Most notice that falling asleep feels slightly easier because the fluid redistribution on lying down is less abrupt. Days 4 to 7. Most people begin to see a difference by morning. Ankles that previously woke swollen start waking closer to normal. The sock groove at the end of the day may begin to fade faster. Week 2 to 3. Evening swelling reduces meaningfully. Energy in the legs improves. Many patients describe their legs feeling lighter, less heavy by evening. Sleep quality frequently improves as nighttime fluid redistribution becomes less disruptive. Week 4. With consistent practice, most patients report their ankles maintaining closer to their morning state throughout the entire day.
Size. The 5 minutes becomes automatic, a habit that repays itself in comfort every single morning. Pause. I want to be clear. This is not a cure for advanced lymphedema or venous disease, but for the vast majority of people experiencing age-related lymphatic decline, this protocol produces real, measurable, consistent improvement. I have seen it transform how patients feel in their bodies.
I want to close with something I think about often. Your body gives you signals every day. The groove left by your sock, the heaviness in your legs by evening, the bathroom trip at 2 in the morning that you have come to accept as normal. These are not signs of inevitable decline. They are messages from a system that has become undersupported, and systems that become undersupported can be helped. 5 minutes, every night, before your body has to manage a full night of poorly distributed fluid on its own. That 5 minutes is not just about your ankles. It is about the quality of your sleep, the lightness in your legs when you stand up in the morning, the energy you carry through the next day. Your lymphatic system has been working for you since the day you were born. It simply needs more support than it did at 30. Give it that support, starting tonight. I am Dr. Elizabeth Kavaler, and I will see you in the next video. If this video opened your eyes to something your doctor never explained, please hit the like button. It tells me this type of content is helping people. Subscribe if you have not already. I release new evidence-based health videos every week, designed specifically for people over 50 and 60 who want real answers. Comment the word ankles below if you are starting this protocol tonight. I read every comment and I reply personally. Tell me which pattern you recognized yourself in, and share this video with someone who has been told their swollen ankles are just aging. They deserve to know what is actually happening and what they can do about it tonight.